HIV human immunodeficiency virus is a virus that attacks the immune system, specifically targeting CD4 cells, T cells, which are crucial for the body's defense against infections. Over time, if left untreated, HIV can lead to the disease AIDS-acquired immunodeficiency syndrome, where the immune system is severely damaged, making the body vulnerable to opportunistic infections and certain cancers. Transmission: HIV is transmitted through contact with certain body fluids from a person who has HIV. This can occur by unprotected sexual contact, anal, vaginal, or oral sex with an infected person without the use of condoms or other barrier methods, sharing needles, using contaminated needles or syringes for injecting drugs, blood transfusions, receiving contaminated blood products, though this is rare in countries with strict blood screening procedures, mother-to-child transmission, during pregnancy, childbirth, or breastfeeding if the mother is HIV positive, exposure to contaminated blood, through accidents involving needles or other sharp instruments contaminated with HIV-infected blood. Symptoms: HIV symptoms can vary depending on the stage of the infection. Acute HIV infection primary stage occurs 2 to 4 weeks after exposure. Symptoms are similar to the flu and may include fever, rash, swollen lymph nodes, sore throat, and muscle aches. This stage is also called acute retroviral syndrome (ARS). Clinical latency stage: chronic HIV can't last several years, where the virus is active but reproduces at very low levels. People may not have symptoms or only mild ones during this stage. AIDS-acquired immunodeficiency syndrome, the final stage of HIV infection, where the immune system is severely damaged. Symptoms include rapid weight loss, recurrent fever or night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands, and infections or opportunistic illnesses such as tuberculosis, pneumonia, or certain cancers, e.g., Kaposi's sarcoma. Diagnosis: HIV testing. Antibody tests detect antibodies produced by the immune system in response to HIV. Antigen/antibody tests detect both HIV antibodies and the P24 antigen, the protein produced by the virus. Nucleic acid tests (NATs) detect the virus's genetic material. These are used in specific cases, such as early detection or confirmation of infection. Rapid tests provide results in 20 minutes or less, often used for preliminary screening. Confirmatory testing. If an initial test is positive, confirmatory tests, such as the HIV1/HIV2 antibody differentiation test or a viral load test, are performed to confirm the diagnosis. Treatment: antiretroviral therapy (ART). ART is the primary treatment for HIV and involves taking a combination of HIV medicines, usually 3 or more every day. ART helps reduce the viral load to undetectable levels, improves immune function, and prevents the progression to AIDS. Common classes of ART include nucleoside reverse transcriptase inhibitors and ARTIs, e.g., tenofovir, emtricitabine. Non-nucleoside reverse transcriptase inhibitors and ARTIs, e.g., efavirenz, nevirapine. Protease inhibitors PIs, e.g., lopinavir, ritonavir. Integrase inhibitors, e.g., dolutegravir, rolutegravir. Fusion inhibitors, e.g., enfuvirtide. CCR5 antagonists, e.g., mavorixafor. Pre-exposure prophylaxis (PrEP). For people at high risk of HIV, taking PrEP, a daily pill, can reduce the risk of acquiring HIV. Post-exposure prophylaxis (PEP). Emergency treatment taken within 72 hours after potential exposure to HIV to prevent infection. Treatment for opportunistic infections. Managing and treating infections and cancers that occur due to the weakened immune system in advanced HIV or AIDS. Prevention: safe sex practices. Use condoms consistently and correctly during sexual intercourse. Reduce the number of sexual partners and consider mutual monogamy with an HIV-negative partner. Regular testing. Regular HIV testing for those at risk or who have been exposed to HIV. Needle exchange programs. Access to clean needles and syringes for people who inject drugs. HIV education. Awareness and education on preventing transmission and understanding HIV. Mother-to-child transmission prevention. HIV-positive pregnant women should receive ART to reduce the risk of transmission to their baby. Living with HIV with proper treatment and care. Many people living with HIV can lead long, healthy lives. Key aspects of managing HIV include adherence to medication. Consistent use of ART as prescribed is crucial for maintaining viral suppression and overall health. Regular medical care. Ongoing monitoring of viral load, CD4 count, and overall health, along with regular check-ups with healthcare providers. Healthy lifestyle. Maintaining a balanced diet, exercising regularly, managing stress, and avoiding smoking or excessive alcohol use. Mental health support. Accessing support services to address mental health needs and coping with the emotional impact of living with HIV. Conclusion: HIV is a serious condition but can be effectively managed with modern treatments. Early diagnosis and adherence to treatment are critical for managing the virus, preventing progression to AIDS, and maintaining overall health. If you suspect you have been exposed to HIV or have concerns about your risk, consulting with a healthcare provider for testing and preventive measures is essential.